You know that in the beginning, we were not sure if there were asymptomatic infection, which would make it a much broader outbreak than what we're seeing. Now we know for sure that there are. It was not clear whether an asymptomatic person could transmit it to someone while they were asymptomatic. Now we know from a recent report from Germany that that is absolutely the case. We still have a low risk to the American public, but we want to keep it at a low risk.
One day after the World Health Organization declared the coronavirus outbreak a global health emergency, the U.S. is sounding its own alarm, declaring a national health emergency. That means the Trump administration is taking a number of steps. First, the U.S. is now advising Americans against any travel to all of China, where the outbreak began. Flights arriving from China will be restricted to 7 airports, and any foreign nationals who pose a transmission risk will not be allowed to enter the U.S. That would be those who've been to China's Hubei province within the last 2 weeks. Significantly, U.S. health officials also now say, as you heard in that clip, that there's no doubt the coronavirus can spread even when the person who has it doesn't have any symptoms. That's not what health officials in this country said earlier today, though.
As far as the WHO and from also Dr. Theresa Tam, their assessment of the situation is the information supporting that is still very weak. Nevertheless, we'll keep looking and try to address it.
A Public Health Agency of Canada, WHO, are saying that at this point we don't have hard evidence of infectivity of an asymptomatic person.
Joining us now to discuss the latest on the coronavirus situation in Canada is Canada's Health Minister, Patty Hajdu. Hi, Minister.
Hi, Vashi.
Thanks very much for coming in. I want to start off with this declaration from the United States and ask you, does it change anything in how Canada is addressing the situation? Does it up the pressure, for example, on your government to reevaluate whether those kinds of measures need to be taken here?
You know, Vashi, we've been following closely the recommendations of the World Health Organization. And in fact, Dr. Tam, who you know is our Chief Public Health Officer, is an expert advisor to the committee. And all along we've been in compliance, if not exceeding, the measures that the World Health Organization has recommended. And so we're comfortable that we are completely up to date in terms of our approach and what the science says to date. And so we believe that the approach that we're taking is respective of the fact that there is a very low risk to Canadians, that we've had processes in place since we've noticed the cluster in December 31st, that we've got a fantastic collaboration with provinces and territories that have allowed us to quickly identify people who may have the virus and then contain the spread.
So there's no, your government essentially is not considering declaring a national health emergency at this point.
That's correct. And we use the evidence as it emerges to adapt our response, to change things that we may be doing either
What does change it? Like what would change it to all of a sudden declaring a national health emergency?
Well, of course, if the World Health Organization was to change its assessment of how the disease was spread, if the consensus around the science was to gel, if in fact, for example, there were new aspects to the virus that were detected, there are a number of different situations that could change the way that we manage this domestically. But as you heard the Chief Public Health Officer of Ontario say, the science is still quite weak. There are some reports, but the World Health Organization does not believe at this point that the virus is contagious when people are asymptomatic.
So that's what I do want to ask you, because up until now, that's consistently what we've heard from Canadian health officials. But then we have this health official in the United States, and this was right from the White House, that they were talking, saying, no, we have enough evidence that we do believe that if someone who doesn't have symptoms, can spread this virus. What is your latest information on the science behind that? Is it the position of your government right now that can't happen?
So our position is completely in line with the World Health Organization's position, which is at this time there is no sufficient evidence to say that the virus can be spread when people are not exhibiting symptoms.
And so if there were to be sufficient evidence, is that something that then would be factored into how this country ends up dealing with it?
All of the new evidence around the virus, its transmission, the way it is spreading across the globe, how we're managing as a country, any kind of alerts at the provincial or municipal municipal level is factored into the decision-making process. I'm extremely comfortable with the leadership of Dr. Tam and her level of expertise that allows her to contribute at the World Health Organization. It's also important that we act as an advisory body to the World Health Organization as well. I mean, the experience of Canada since SARS has allowed us to learn a lot and to put into place a lot of measures, including formal mechanisms that allow us to share information very rapidly through our jurisdictions.
So let me ask you, are we taking our cues from the WHO when it comes to, for example, the conclusion that the science isn't there yet, the evidence isn't there yet to support the claim that it can travel through from someone who's asymptomatic, and if so, why isn't the United States?
I can't speculate about what their decision-making process is like and what kinds of factors went into their decision around their new restrictions, but I can tell you that there are leading scientists that are feeding into the body of evidence at the World Health Organization and that are taking this extremely seriously.
Are we doing our own assessment?
Of course we are, and we are contributing to the international research as well. In fact, we have some very sophisticated research happening around, for example, immunization. That's a long ways away, but still a contribution that Canada is making. And that's one of the recommendations, actually, of the World Health Organization through their declaration of a public health emergency, was to support that research and to support countries that may have less sophisticated systems of surveillance and protection.
What's the latest on being able to bring the Canadians who are stuck in Wuhan back to Canada? I know that your government 2 days ago announced that it's secured a chartered airplane. You were still trying yesterday to secure landing rights from China. Where does that stand?
So we are, in fact, in negotiations with the Chinese government right now about how and where to land, but also all of the other details that go into how we ensure that people that are coming are well and how we transport people and facilitate their return to Canada. And I'll have more to say about that next week as those details evolve. And I'll be here to talk about that with you if you'd like.
I hope so. Can I ask a little bit more about the timeline where that is concerned? Yesterday, we asked the Minister of Foreign Affairs about this, and he cited, for example, the UK and how they were still in negotiations. Well, today they brought their citizens home. Why is it taking longer for Canada to be able to do that?
Part of our challenge was in the early days, we didn't really have a sense of very many Canadians in the region, and that was partly because people hadn't registered on the Global Affairs website that allows us to know exactly where Canadians are when they're abroad. As you know, in those early days of this, I was speaking a lot about the need for people to tell us where they were, and as I was doing that and others were doing that, of course, people started to indicate that they were there, and we could start to do that work of determining, did they want to leave, did they want to stay? Not all Canadians that are in the region want to leave. They need other support.
There are about 200 now who do
Absolutely,
that, right?
and we will be helping them very soon. But there were considerations in terms of trying to contact of those people and determine what their needs are. And so
should the government, though, have sort of got the ball rolling earlier? If we are now seeing evidence of other governments being able to act sooner?
I think we've been working very diligently to make sure that we can do this as quickly as possible and as safely as possible. We want to protect the health of Canadians here, but we also want to make sure that the health of the Canadians that are abroad is good.
I'm glad you brought that up because there are a lot of questions from Canadians about what happens when these people come back, when these Canadians come home. What is being considered? Will they be quarantined as the U.S. decided they will be in that country today?
So we'll be taking measures that we will base on science in terms of ensuring that people are non-infectious when they return to their communities or that they have the supports that they need, should they fall ill afterwards. But in terms of China's process, what we know from other countries is that sick patients won't be able to travel. And that's a really important consideration. We'll be monitoring people along the way and supporting them. But, I think...
Does that mean, am I to interpret that as you don't think that there will be a necessity for quarantine if, in fact, China's not letting anyone sick travel?
I'm saying that we're assessing all options right now. What I can tell you is that we're doing through the lens of protecting people's health no matter where they are.
Is there an updated timeline on when you think China might be granting those landing rights, when you might see some action in China? Is it next week, do you think?
It's hard for me to speculate. Those conversations continue.
All right, I understand. Thanks a lot, Minister Hajdu. Appreciate your time today. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.